Aloha and good afternoon here from Hawaii. My name is Jürgen Steinmetz, joining you from Livestream.travel and eTurboNews.
World Tourism Network President awarded U.S. Public Health COVID-19 Pandemic Civilian Service Medal. COVID's worst enemy has been the travel and tourism industry. Members of this industry had been fighting back in every country, from every sector of the industry. Many leaders are part of the World Tourism Network rebuilding travel discussion. This effort was recognized by the U.S. government with a medal presented to co-founder and president Dr. Peter Tarlow. The World Tourism Network emerged as an organization out of the rebuilding travel discussion launched a year ago in March 2020 in Berlin, Germany. The goal was to start a conversation on the emerging COVID-19 pandemic. Close to 2,000 tourism leaders from the public and private sector in 127 countries are working as members and observers within WTN. The objective is to find and coordinate a way forward beyond COVID for the global tourism industry. The U.S. government this week recognized WTN president and co-founder Dr. Peter Tarlow for his hard work with the World Tourism Network. Dr. Peter Tarlow was awarded the United States Public Health Service COVID-19 Pandemic Civilian Service Medal. It is with great humbleness and humility that I accept the United States Public Health Service COVID-19 Pandemic Civilian Service Medal presented to me by Admiral, Ret. Dr. Brett Girar. This medal speaks to the hard work that the World Tourism Network is doing as an ally in the fight against COVID-19. COVID not only destroys lives but also destroys economies, and no industry knows this better than the travel and tourism industry, Dr. Peter Tarlow said after receiving the medal on his 75th birthday in College Station, Texas. The medal was presented by U.S. Admiral Brett Girar. www.youtube.com. All of us involved in the World Tourism Network are very proud today. Peter has been recognized by the U.S. government for his work in our young organization. We hope this recognition will help us in our future work, in establishing partnerships, and specifically in bringing forward our latest advocacy project known as Health Without Borders, said Chairman and co-founder Jürgen Steinmetz, who is also the publisher of eTurboNews. World Tourism Network, WTN, is the long overdue voice of small and medium-sized travel and tourism businesses around the world. By uniting our efforts, we bring to the forefront the needs and aspirations of small and medium-sized businesses and their stakeholders. World Tourism Network emerged out of the Rebuilding Travel discussion. The Rebuilding Travel discussion started on March 5, 2020 on the sideline of ITB Berlin. ITB was cancelled, but Rebuilding Travel launched at the Grand Hyatt Hotel in Berlin. In December, Rebuilding Travel continued but was structured within a new organization called World Tourism Network, WTN. By bringing together private and public sector members on regional and global platforms, WTN not only advocates for its members but provides them a voice at the major tourism meetings. WTN provides opportunities and essential networking for its members in more than 127 countries. By working with stakeholders and with tourism and government leaders, WTN seeks to create innovative approaches for inclusive and sustainable tourism sector growth and assist small and medium travel and tourism businesses during both good and challenging times. It is WTN's goal to provide its members with a strong local voice while at the same time providing them with a global platform. WTN provides a valuable political and business voice for small and medium-sized businesses and offers training, consulting, and educational opportunities. Our Rebuilding Travel initiative is a conversation, an exchange of ideas, and a showcase for the best practices by our members in more than 120 countries. Our Tourism Hero Award recognizes those who go the extra mile serving the travel and tourism community but often get overlooked. Our Safer Tourism Seal gives our stakeholders and destinations a platform to express their willingness to reopen tourism safely and responsibly. To accomplish these goals, WTN on its interest groups. Our members are our team. They include known leaders, emerging voices, and members of the private and public sectors with a purpose-driven vision and a responsible business sense. Our partners are our strength. Our partners include private sector organizations and initiatives and destinations, the hospitality industry, aviation, attractions, trade shows, media, consulting, and lobbying, as well as public sector organizations, initiatives, and associations. More information on the World Tourism Network and on joining this important initiative, please visit www.wtn.travel.
Today we'll be going to Nepal and briefly to India to hear more about the situation surrounding the COVID spike in both countries. It appears with India in a dire situation, Nepal isn't too far apart. So we'll be talking to Pankaj, our colleague based in Kathmandu, to hear more. We're also going to give you some input in a conversation, not an interview, we had with a gentleman in India, and he is in a very safe area in Kerala, but has a different view why India is in the situation it is. Also, we'll be touching news items that make headlines today on Thursday, May 6, 2021. With me, as always, is Dr. Peter Tarlow in College Station, Texas. And Peter, it's a fairly nice day here. A little bit, I see we may have some rain coming up here fairly soon. So time for me to get to the beach.
Yeah.
Before this happens. But
yeah.
How are you? How's everything in College Station?
Everything in College Station today is great. Nice warm day in the upper 70s, lower 80s. And tomorrow it's supposed to be, over the weekend, a really warm weekend. And of course, it's coming up to Mother's Day, so everybody's hoping that there'll be blue skies and a gentle wind. You don't always get what you want, but that's at least what we're hoping we're going to get. But it's not like on the East Coast. The East Coast is having a real cold spell right now. Though that's kind of good because, you know, those 15 states are expecting a major invasion of cicada, which are these little animals that come out of the ground every 17 years. And there's trillions of them, not billions, trillions. It's like a budget coming out of Congress. So it's a real connection. But of course, the big issue I see is issues of COVID. And I see our friend from Nepal, I believe, is joining us.
Yes, Peter. One of the things we wanted to talk about today is about the COVID situation in India. And unfortunately, it seems to be spilling over also to neighboring Nepal, and I don't know what the situation in Bhutan and Bangladesh is. But we have an expert who's joining us right now. Just for everyone's information, in India today, we had more than 421,000 cases. And that may not be even 412,000, I'm sorry, 262. And this may not even be the full number. And
no, it probably is not. Even in the United States, because of the way that COVID works, the reporting is usually no more, at the best, really at the best, maybe 70% accurate. So probably in India, it's probably you could double the number and be pretty close.
Yes, and I wanted to recognize and welcome and also thank our good friend Pankaj with Four Seasons Travel in Kathmandu, Nepal. Namaste, Pankaj, and thank you for joining us. We're all a little bit concerned reading the news about India, and you're so close to India, and I think some of the terrible situation happening in your neighbor country is now also becoming a threat to your own country. So we're all concerned. But hopefully you're doing well. And thanks for joining us. Give us an update.
Yeah, and Pankaj, by the way, please take good care of your health.
Thank you, Dr. Tarlow. It's really a pleasure. Namaste from Kathmandu. Jürgen, well, yes, the situation is pretty challenging, and as you rightly described, this is unprecedented, and this is Kathmandu is presently in lockdown situation, so absolute zero movement except the essential services. This is third lockdown in last 1 year, like after March 2020. So looking at the present scenario, this is definitely challenging. As you've mentioned, India is facing a tremendous challenge, and here also we in Kathmandu new cases rates 3,000 plus. However, we need to look into the recoveries also. That is 2,700. So people are fighting back well, but the only thing what we are really concerned is the facilities in terms of health care.
Yes.
Here, I would like to mention that even the vaccine drive was administered pretty positively or pretty well. Here, even the vaccine was given for adult above 18 years. So
18
that
years,
is,
above 18.
yes, 1-8. So that is pretty much, if when I spoke to some of friends in Europe or even Canada, they were waiting, where here it was given in Kathmandu and most parts of the districts. So in that is a positive side. And as you know, Nepal almost relaxed the international tourist arrival or international visitors arrival. It had, relaxed in terms of quarantine, and the quarantine was not, mandatory with negative PCR. But now things have come back to square one. So since last night, the international flights, domestic flights were stopped 3 days back.
2 days ago.
And since last night, no international flights. So it's on the hold, or it's stopped. So I think that is necessary to contain the growing, infection. And we have, the border with Nepal shares, over 1,000 kilometers long border in the southern part. So official borders are already sealed. So there's no movement. With India. Yes, the China was stopped long ago. So we hope that Nepal manages to fight back well. And the second wave looks to be pretty contagious, as the new variant from India or new Indian variant, though it looks to be less fatal, but spreading pretty, fast. So the total case in Nepal as of yesterday has gone to 368,580 to be precise. So, looking back like a month ago or two, it seemed that things have come back to absolute normalcy. People were traveling. Domestic travels had really increased, and people started traveling in, internal tourism. But now this is the time to put safety first, and that's what Nepal government is doing. Nepal Tourism Board and various tourism associations are working towards, repatriate the stranded travelers, because quite a few travelers came. And as you know, Nepal, the length of stay is long, almost 14 days, and people come here for long treks. They undertake 2 weeks, 3 weeks. So they are trekkers up in the mountain. And this was a spring season, though it was not really as expected, and that is no surprise. So now the people who are up in the mountains, we do hope that next 1 week, the trip will be, they will cut short the trip, or they come back. But looking at the past, when the first lockdown was clamped, the travelers were taken care of pretty well. Probably, this was a great example as Nepali hospitality.
Yes.
They were given food, they were given shelter.
So I was going to ask you, if I was stuck in your hotel, I can't leave now. How are you handling that?
Not a hotel, that's his house, I would assume.
No. But I were at a Four Seasons hotel.
No.
Well, let me. Well, Four Seasons Hotel is not in Nepal. The company that I'm with is Four Seasons Travel.
Okay.
It is not a hotel. We do have.
But any hotel. I'm in a hotel. How would the hotel handle me? Do they throw you out? Do they?
Well, we have quite a few international chains here, like Hyatt Regency, Marriott, Radisson. right? So they all were doing pretty well. They almost bouncing back to business, and few hotels never was shut down. They were still providing services, and that is good in a way. Restaurants were back into operations, and now everything is in the absolute shutdown mode, as the non-essential movements are on hold. So the hotels are not expected to operate, but those who were here, and then until yesterday, since the international flights were operational and the lockdown was clamped a week ago, so there were few clients or the guests in the hotels. The hotels are taking care of them. So they have not, those hotels which had clients or guests, they're still providing services. They're not shut down and say, okay, you're on your own. I don't think that is the way Nepal operates. Yes, over to you, Dr. Tadlow.
That is definitely the hospitality in Nepal is fantastic, and I know the first wave last year you handled the situation absolutely fantastic. Every tourist was taken care of, and everyone was active at Nepal Tourism Board in the private industry, working together to get tourists either home or make them feel comfortable if there was no way of getting home immediately. Just for our listeners, a little bit of information. This is according, you may correct me here, Pankaj, but according to my statistics, Nepal has 29,577,000 residents. And on the COVID, there are 368,580 that suffered or were diagnosed positive with COVID over the last year. And out of this, 292,490 recovered, but actually leaves an active count right now of 72,561. Yesterday, 8,970 new cases emerged, what is a high number compared, to the numbers altogether. And unfortunately, 3,529 people died in Nepal, and 54 yesterday. So it is high, but it may not be as alarming as it sounds compared to the history, and also compared to some other countries, specifically India and Brazil. But the closeness to this giant India, where the situation is really dire, of course, is very worrisome. Do I have this correct, Pankaj?
Jorgen, your data is very correct, but let me point out what you said. 3,529 was not in a day, the death. It was, like new death was recorded 54, and the total death was recorded 3,529. Right. So in that way, though no lives would be lost, every life is precious for the nation or for the family. But however, looking at the present scenario, you cannot rule out. But the death rate, if you look at the international ratio, this is still, I must say, people are fighting back well, and the recoveries rate is still good. And I do have my immediate family members who are now going through, they were tested positive and they are fighting back. So in my friends' family, associates, they got infected, but most of them have managed to fight back pretty well without going to hospitals. Yes, hospital services are, kind of exhausted because we never prepared ourselves for this kind of pandemic. I mean, when we saw the case of New York or Italy, so no surprise, Nepal was. But the good thing is Kathmandu does have few very international standard hospitals, and they are doing their best. And the volunteer groups, health worker, they all are working tirelessly to make people, not to panic. What we realized, what we noticed, people give up too soon when they are in the fear mode. So in that way, I think the support system or the network in the society is working fine, and the family support here is tremendous, as we are a very close knitted society where people support each other despite of COVID. Just don't lock yourself and then you don't go to others. Yes, you keep a physical distancing, you take the precaution, put PPE or other, protective sales, but people are supporting each other. There are people who are offering free food even in this situation, to those who daily wage workers. So I think the resiliency in the society is pretty high, and that has helped the country to fight back, pretty well. And the travelers can see that, there's no panic, despite of the number showing alarming. The panic mode is not there. Still, people are, looking forward to fight back well and to contain the virus. And as I mentioned, the jab, since people got the first dose, over 1.5 million, so even few got the second jab, right? So that has also instilled much of kind of hopefulness that, okay, I got the vaccine and I can fight back, because in many cases it appears when the mind gives up, the body can also give up pretty easily. So I think the first round of vaccine also worked. And there I'd like to add the tourist guides, hoteliers, frontline workers in tourism they were also given preference by the government, right? So most of the frontline workers did get the vaccine pretty early. So that also was a good sign if we connect this pandemic with tourism industry, though, all the industries are affected and tourism is no different. Over to you, Thomas.
I'm wondering, what is the percentage of people that are fully vaccinated or partially vaccinated? Do you have any idea? Pankaj, I think you're muted.
Okay, I was muted. Well, I don't have exact data, but so far it is less than 10%. But I would not really be able to tell you exact number, because there were various drives going on, and it's not only Kathmandu, also in the district. So I need to check and update you on that.
No,
but what I know for sure is the first one was given above 60 years. And then there was another drive between 18 to 59. That was the Chinese vaccine. Nepal started with serum, that is AstraZeneca, and that was pretty successfully administered. So the frontline workers, even tourism frontline staff, teachers, they all were given vaccinations. So it was pretty, properly administered. But the second dose, which was supposed to come from India, got delayed primarily because of, pandemic in India, and they could not also supply properly to the growing demand. But all in all, it was done way earlier and better than expected. Thank you.
I mean, we've been supporting with World Tourism Network and our new Health Without Border initiative, the relaxation of COVID patents. And I know this was also now an initiative. It's also now supported by President Biden. That patent,
at least for the moment.
At least for the moment.
Yeah, there's a big pushback now.
I heard from Germany for some reason. I haven't investigated why. But how is this seen in Nepal? If the patent was relaxed, would Nepal have, I think we lost him.
Yes, I
Okay,
think so.
we lost Pankaj. Let's see if he comes back. I was asking him if the relaxation of this patent law would benefit Nepal. So maybe if we get him back, we would ask him this question.
Yeah, that's an interesting discussion because there's now a lot of pushback, and I'm not sure that President Biden will stick with his decision. A lot of people are saying that they invested hundreds of millions of dollars, and that if they do this, no one will ever develop another vaccine. It will be the end of the pharmaceutical industry, because they're arguing that they spent 10 years and hundreds of millions of dollars. Now, the other side of that you can argue, because there's both sides, is that the US government put a lot of money into it. And so it was not just pure risk on the part of the pharmaceutical industry. But there is this big discussion going on. Is this moral and ethical to break a patent and something like this? And what does that do to the people who gave up, years of their life in developing these things? And what will happen for the next? Are we looking for a quick solution, and then later on, it will not? The negative consequences will be worse than what we thought. So I don't know. I'm just pointing out that there's two sides of the story, and there's a big discussion going on.
Yeah, and of course, our government invests billions of dollars.
That's right.
Money in getting a handle of the situation. And what is true is no one is safe until we all are safe. I also agree with you. The patent isn't important. It's a business, unfortunately, or fortunately, either the way you see it. And it's not fair to steal from a business. But then there is life. Life is precious, and life needs.
No, this is a really interesting issue, moral dilemma. And it's really, if you break it down, it's the issue of life versus stealing on some level. And at what point do we say that life takes precedence? Is there a third way? Could it be that we just produce the vaccine nonstop, and then the United States exports it to around the world? And so we send millions of doses around the world. Maybe that's another way of doing it.
Maybe franchising it with reduced rates or substituted rates.
I'm not sure it's black and white. I do know there was an incredible amount of discussion around the United States today about that. And it's very clear the American government said something yesterday, but is rethinking its position today.
Well, we see, and definitely our initiative, we will follow this very closely. And I know there are recommendations in one way or the other. Maybe in just giving up the patent right may not be the safest thing to do either. So we have to look at this, because there could be a lot of pharmaceutical institutions around the world that don't take rules and regulations and even a generic product as serious to make it safe enough.
Well, so we know that. We already know that there has been forgeries of even the people have claimed that they have Pfizer and Moderna, which are the top vaccines, and they really were not Pfizer. They were forged Pfizer and Moderna, and certainly people will cut corners in lots of the world. And for example, I was interested hearing our friend speak from Nepal. The main vaccine they were giving was the Chinese. Well, the Chinese vaccine is the least effective of all vaccines. So they had vaccinated maybe 10 or 15% of their population, but with not a terribly effective vaccine. And so I can understand, where that comes. Oh, here he's back again before we have to end our conversation.
Yeah, no, and Pankaj, maybe one more point before.
Well, I was thrown out. I'm so sorry, I was thrown out and the internet.
But we talked about you with lots of smiles.
So if I may conclude before you finish, Dr. Tarlow, you're asking something, and let me congratulate you for being awarded as the.
Oh, thank you.
This health service support.
Yes.
Amazing.
Yes, it's the highest award that a civilian can get in the United States dealing with health. So yes,
great news. Thank you for your unrelenting support.
And you know that we will do everything we can. I think what you're talking about, because we don't have a lot of time, but we can summarize this, and that is that we have an initiative now called Health Without Borders. And one of the things that we're saying is that if you have illness in one country, unless we wipe this out throughout the world, you cannot close your borders. You can try, but you know what? Viruses do not say, haha, I'm at the border and I'm going to turn around and go back. They jump borders very easily. And that's a real, so if you have a terrible situation in India, you can expect it's going to eventually cross the border. You can do the best, you hope, to limit it, but you cannot prevent it. It's like saying, I only want it to rain on your side of the border, but not rain on my side of the border. So I think the whole concept of the World Tourism Network of Health Without Borders is really an important issue, because you know what? We all live on one small planet, and we all are just part of a very small world community, and we can't afford to be selfish to each other. We really need to protect each other.
That's interesting insight, Dr. Tarlow. I really liked it. So we need to go and find the root, not the branches. We're cutting the branches, getting the root,
and find a way that we can really protect us all. And that way, one day I will finally get to Nepal. But I can't go till it's healthy. So I'm looking forward to the day that I can come back and see you all in Nepal and enjoy everything that you have to offer.
Thank you, Dr. Tarlow. Thank you, Jürgen, for covering news from Nepal. And we really hope and look forward for a very healthy planet, and so we can travel once again back to this planet.
And an important question we had before we lost you here, and I'm quite curious. We have entered the discussion with health, with our health group, in regards to the patent rights for a US made vaccine. And there's a big discussion. President Biden very quickly said, oh, this is a great idea. Let's lift the patent and give everyone the chance to produce the vaccine. Now, a day later, there is a lot of kind of opposition to it. People saying, okay, but how safe is this? And would a pharmaceutical company that is a private company ever produce another vaccine if this money is stolen from them? So there's a lot of back and forth, and there's probably not a real solution that you can say is a win-win for everyone. But of course, lives are at stake, and no matter what it is, life is, the highest priority anyone can have. And so, how do you see this issue with?
Well, this is interesting. Last night only, I got this petition to be signed by one of my friends in Toastmaster Network. That it's already here. Also, people are signing that this should be the case. It should be free from copyright. And I think more than persuading these pharmaceuticals, which is the largest industries, they should learn from Volvo. When these three-lock safety seat belt, which was developed by Volvo, they did not keep it with themselves, and that simply was shared and made it free from copyright. Or their intellectual property, though they invested on R&D. If you go back to the safety belt, which saved millions of lives. So pharmaceuticals should learn from Volvo, and this should be the norm. They will make tons of money if people are alive on this planet, and 7 billion plus people are a big market. So let's keep 7 billion intact, and then, they can do a lot of business later.
Yeah, real valid point, and it's not an easy situation for anyone, I think. And we will definitely be following this very closely. But it's right now, I know you're dealing with a difficult situation in Nepal. Please stay healthy. I'm very sorry to hear about your relatives, and hopefully they stay healthy despite COVID. A lot of people I know, they went through COVID. My own nephew went through COVID, and it wasn't such a big deal. So let's hope this also to be the case for your relatives. And it is luckily the deal for most people who get COVID. It doesn't become such a big deal, but there are, of course, exceptions, and there are many times they're terrible. But Peter, I don't know if there's anything else you wanted to ask.
No, I just want to wish you all the best and let you know that you're in our prayers.
Thank you, Dr. Tarlo, and thank you, Jürgen. Stay safe, and let's stay connected, and let's share the joy and positive vibes from the Himalaya. Thank you. Namaste once again.
We will definitely
bye-bye.
The story in Pankaj. Feel free to contact us anytime. We like to have you back here and see how the situation is going. And for everyone else who is listening to us, please stay tuned, because we're going to play our articles of today, so you can listen to them after this live broadcast. And then if you wanted to watch us after this, simply go to livestream.travel or go to our YouTube channel, YouTube at .com/travel news or youtube.com/eTurboNews, and you can actually listen to all the archives. Better off, what you should do, click on the red subscribe button in YouTube and also on eTurboNews.com, and you'll be notified when there are new videos and new sessions uploaded, what probably would be the easiest. But to all of you, thank you very much for joining us. And Pankaj, thank you very much for your time. And yes, please stay safe. And my best regards to everyone we know in Nepal. And we know quite a few people now in Kathmandu. And as Peter says, our prayers are with all you guys. And we talk to you and hopefully some of your friends in the near future. And we're here for you if you need us. Let's switch very quick to Kerala in India. And this is not an interview, as I said, it's a conversation we had earlier. And I think the feedback we're getting is quite interesting in how people feel. Let's listen in.
India's COVID-19 tally surpassed 21 million with 412,262 new cases today. 412,262 new COVID-19 cases were registered across the country in the past 24 hours. India registers over 400,000 cases in a single day for the second time this month. Two types of vaccines, Covishield and Covaxin, are being administered to the people in India. India's Ministry of Health and Family Welfare announced that the country's coronavirus tally surpassed 21 million today as 412,262 new COVID-19 cases were registered across the country in the past 24 hours. This is the second time this month that over 400,000 cases have been registered in a single day. As many as 3,980 deaths, a greatest daily number so far, were recorded in the country since Wednesday morning, taking the total death toll to 230,168, added the Health Ministry. The COVID-19 figures continue to peak in the country every day, as the federal government has ruled out a complete lockdown to contain the worsening situation. Though some states have imposed night curfews or partial lockdowns. India's capital city of Delhi has been put under a third successive lockdown till May 10. While some school examinations stand cancelled, others have been postponed in the wake of COVID-19 situation. Delhi, which has been one of the most COVID-19 affected places in the country, witnessed 20,960 new cases and 311 deaths through Wednesday. So far, as many as 18,063 people have died in the national capital due to COVID-19, confirmed the Delhi's health department. The number of daily active cases has been on the rise over the past few weeks. In January, the number of daily cases in the country had come down to below 10,000. Indian government has ramped up COVID-19 testing facilities across the country, as over 296 million tests have been conducted so far. As many as 296,775,209 tests were conducted till Wednesday, out of which 1923,131 tests were conducted on Wednesday alone, said the latest data issued by the Indian Council of Medical Research, ICMR, on Thursday. Two types of vaccines, Covishield and Covaxin, are being administered to the people in India. India also received its first doses of the Russian-made Sputnik V vaccine on Saturday.
Are you in Maldives?
No, he's
No, I am in Kerala.
Oh, okay. Oh, you guys have a big problem with COVID right now, right?
Kerala, we have no problem, but rest of India, yes.
So it's better in Kerala. Okay.
Kerala is properly monitored. Rest of India, there is no systems.
Right. Yeah, it's kind of news.
Everybody wants to make money with it.
But how do you make money with death? It's
Black marketing, done by the government.
The vaccine, you mean?
Everything. No,
it's too bad.
Oxygen cost maybe $5. Now you know how much it's selling for? $700, $800.
That is insane. What happened to all these international help coming in?
No systems. They are lying in the airport. Nobody knows.
That's not good.
So even that help, it doesn't take care half of one city's population.
Right.
300, 400 tons is nothing. It's a daily use. Anyway, it doesn't matter.
So it's population control.
Yeah, see, how much it came? Around 400, 500 tons. That is used in a day.
Yeah.
Wow.
Nothing.
That's terrible.
You understand? All the help landed till now, it's just half a day's thing in one city.
Wow. I mean, but when we hear the news, it's really, really...
It's really bad.
Yeah.
Really bad. Nobody's reporting. They were hiding it.
Yeah. And the numbers are still like underestimated. I think they could be 3 times as high from what I...
Yeah, the fundamentalist government sitting there was not bothered. They are only bothered about winning election. They never bothered to. The reports were there. We need this much. They didn't care. They didn't give orders to vaccines. 1.3 billion, only 16 million vaccines order is given.
Wow.
They collected from people around $4 to $5 billion. Nobody knows what happened to that money.
Oh, this is sad,
It's another Trump, you understand? Worse than Trump.
Yeah. But you're personally, you're safe?
Yeah, I am having an immunity booster, this one.
Okay.
We are on that. So I got first contact in Dubai 2-3 times. My test became negative.
Yeah. But did you have the vaccine?
I took vaccines both.
So you should be okay then.
No, vaccine won't do any help.
You don't think so?
You
don't think so? I mean, what are we all then getting? So
the vaccine, what it does is, even if you get COVID, your intensity will be lower.
Right. But you can still get it. Yeah, absolutely. Yes.
You will get it, your intensity will be low. That's it.
Right. Aloha, good evening, namaste.
Namaste.
Here from Texas, good night. Good morning to you.
Spanish Tourism Roma opens 6-meter video wall at Interactive Multimedia Center. Spain's digital strategy will be available to Italian tourism operators as soon as the period of restrictions caused by COVID-19 ends. Professionals in the sector will be free to make their presentations and have access to a business lounge area upon request. The space incorporates a 6-meter-long video wall that will allow users to navigate within Spanish destinations. The board displayed IMC on 100 square meters equipped with the latest technological solutions to find information on Spanish destinations through touchscreen technologies and multimedia resources. The IMC was conceived as a new space for presentations, workshops, and meetings. Jorge Rubio Navarro, director of the Spanish Tourism Board of Rome, informed, "We want to make Spain's digital strategy available to Italian tourism operators as soon as the period of restrictions caused by COVID-19 ends." The IMC will be available to professionals in the sector, free to make their presentations and as a business lounge area upon request. Ivana Jelinek, president of Fiavit Confcommercio, Federazione Italiana Associazione Imprese Viaggi e Turismo Italian Federation of Travel and Tourism Business Associations, attended the operation of the digital application and appreciated the advantages that the IMC offers as an innovative meeting space for the trade and for Destination Spain. The space incorporates a specially developed app supported by a 6-meter-long video wall that will allow users to navigate within Spanish destinations. They based the system on the cartographic navigation of the points of interest of Spain divided into 5 categories: main destinations, tourist areas, regions, UNESCO heritage cities, and itineraries. The IMC is the flagship of Spanish tourism in Italy, and the opening is part of a strategy based on safety, digitization, and eco-sustainability in the management and promotion of destinations. One of the products that most reflects these strategic lines is the Camino de Santiago, which foresees the celebration of the Holy Year, Zacabeo, in 2021 as a result of the COVID-19 health emergency extended until 2022. Thanks to the collaboration with Turismo di Galicia, the app of the new space in Piazza di Spagna will have a navigation dedicated to the Path of St. James. Users will, therefore, be able to walk the different stages of the paths, selecting all the resources they wish to prepare for the Zacabean experience in complete autonomy. For the less technological, the CEI provides some assistance available to inform about the Camino de Santiago. The Italian market is the most important in terms of international travelers on the Camino de Santiago. This is the reason why the celebration of the Holy Year Zacabeo 2021-2022 will be the primary product hosted in the CEI space. Hash rebuilding travel.
Israel announces tourism rebuilding plan. Israel's tourism was gravely impaired by the COVID-19 disaster. Plan includes an international advertising campaign to encourage foreign tourists to visit Israel. International flights to the southern Red Sea resort city of Eilat to be resumed. Israeli Ministry of Tourism announced that it has launched a program to rebuild and restart Israel's battered tourism industry, which was gravely impaired by the COVID-19 disaster. According to Israeli tourism officials, the plan includes an international advertising campaign to encourage foreign tourists to visit Israel, focusing on New York and London, as well as the United Arab Emirates, with which Israel signed an historic normalization agreement in September 2020. The plan also includes the program to hold cultural, sports and leisure events in Israel to promote tourism to potential foreign visitors. Resumption of international flights to the southern Red Sea resort city of Eilat is also a part of tourism sector rebuilding program. Last month, Israeli authorities announced that the country would allow vaccinated tourist groups to enter Israel starting from May 23. According to Israeli Central Bureau of Statistics, the coronavirus pandemic has led to a fall of 98.5% in foreign tourist arrivals to Israel during the first 2 months of 2021. Only 9,900 tourists visited Israel in January-February of 2021, while the number was 652,400 in the same period of 2020. Just before the pandemic crisis in the country. According to Israel's Minister of Tourism Orit Farkash-Hacohen, the program will serve as a growth engine to revive the tourism industry and the Israeli economy in a responsible and balanced manner. It is our time to utilize Israel's huge advantage as a health-safe destination, and harness it for the benefit of our empty coffers in the tourism industry, which includes hundreds of thousands of workers, the minister said.
What's new in the islands of the Bahamas in May? A virtual program brings travelers people to people, connecting them with locals. Beachfront Resort, just 50 miles off the coast of Florida, will officially debut its newest private beach, Resorts World Bimini Beach. Sugar Factory Restaurant opens new location set inside Baha Mar on the island of New Providence. News. People to People goes virtual. The beloved People to People program that has been connecting visitors with locals through customized experiences for the past 45 years, is making its way directly into the homes and screens of wanderlusters. The virtual program offers 5 free virtual session themes with local ambassadors in the Bahamas. To book an unforgettable virtual people-to-people experience, head to www.bahamas.com. Increased airlift to the Bahamas. American Airlines announced direct flights from Austin Bergstrom International Airport, Abia, to Lynden Pindling International Airport, NAS, beginning June 5, 2021. Frontier Airlines has also announced that direct flights from Miami International Airport, MIA, to Nassau, NAS, will be available 4 times a week starting July 2021. Viva Wyndham Fortuna Beach reopens. Viva Wyndham Fortuna Beach, located in Freeport, Grand Bahama Island, is welcoming guests back starting this month. The all-inclusive resort boasts an oceanfront pool, water sports, 4,000 feet of beautiful white sand beaches, ocean view rooms and more. Resorts World Bimini's new beach destination, the Beachfront Resort, just 50 miles off the coast of Florida, will officially debut its newest private beach, Resorts World Bimini Beach, on May 14, 2021. The new addition features 2 lagoon pools, hammocks, oceanfront and poolside private cabanas, 2 bars, ocean view dining and much more. The Sugar Factory heads to Baha Mar. Sugar Factory's newest location will be set inside Baha Mar on the island of New Providence. The restaurant will feature a full-service restaurant, cafe, confectionery shop, retail store, carousel bar overlooking Baha Mar's iconic fountains and the debut of Candy Ocean, a one-of-a-kind aquatic-themed immersive experience. Awards and accolades. The Bahamas is nominated as a Best Spa Destination in World Spa Awards. The World Spa Awards has announced the nominees for its 7th annual awards ceremony, and the islands of the Bahamas have been nominated for the Caribbean's Best Spa Destination Award. Voting begins May 19, 2021 and runs through September 8, 2021. The Bahamas is a top 8 travel destination for booking incentive travel. Northstar Meeting Group's latest Incentive Pulse survey revealed the Bahamas as a top 8 popular travel destination for booking incentive travel in 2021. The survey consists of responses from business and sports event organizers, planners and incentive program professionals from all sectors. Promotions and offers. For a complete listing of deals and packages for the Bahamas, visit www.bahamas.com. $250 air credit for out-island vacations. The out-islands of the Bahamas are calling. U.S. and Canadian residents can take their pick of 10 picture-perfect islands that are unspoiled and uncrowded and receive an air credit of $250. Booking window, April 5, May 10, 2021. Extended stay deals. Who wouldn't want to stay in the Bahamas longer? Guests who book a stay for 14 days at Grand Isle Resort on Great Exuma can receive up to 50% off. Margaretville Beach Resort in Nassau is offering guests who stay 14 days or longer a special pricing of up to 40% off regular rates. Third night free for travel advisors at Warwick Paradise Island, Bahamas. To celebrate Travel Advisor Month in May, Warwick Paradise Island, Bahamas is offering appreciation rates and a third night free for travel advisors booking between now and May 31, 2021 and staying through December 20, 2021. More news about the Bahamas. #Rebuilding Travel.